As HIV and AIDS continues to pose a threat to global health, efforts have remained unrelenting to curb the threat and spread of the disease. As part of these efforts, the South-South Learning Network seeks to strengthen HIV prevention programs through shared learning of good country practices. Now, the network provides countries with a platform to gain experimental knowledge from peers in order to harness and share good prevention learnings and inform grant-making and technical assistance needs. News Central's Bettinah Nwelih was at a 3-day event on the HIV prevention interchange, which ended today in Lagos, Nigeria, and has this to say.
In Nigeria, 80% of new HIV infections are caused by unprotected heterosexual intercourse, with most remaining HIV infections happening in key populations such as sex workers, men who have sex with men, people who inject drugs, and transgender people. According to the Nigeria AIDS Indicator and Impact Survey (NAIIS), adult HIV prevalence in Nigeria was estimated at 1.4% among people aged 15 to 49 years in 2018. However, a major challenge in the fight to curb the disease is the stigma that is associated with it, such that even hospitals codenamed the test for HIV as XYZ.
I won't say stigma is gone because we all have different lack a lot of knowledge. Even some of the care providers stigmatizes, but a lot of capacity, a lot of policies. Nigeria has a stigma discrimination law, of course, and there are also VAP laws. And VAC laws, I mean, Violence Against Persons Act, which also criminalizes such. So I think we're getting better.
According to Statista, as of 2021, 1.9 million people in Nigeria were living with HIV. That year, the number of deaths due to AIDS amounted to 51,000, including both adults and children. The highest number of deaths was recorded among female adults, with 17,000 deaths. However, the biggest surprise in all of this is the discovery of a center in Agege, Lagos, that caters to men who got HIV infection via same-sex transmission.
It's a community structure. It's called one-stop shop, meaning people who identify as key population come into the center and receive care because of issues of stigma, discrimination. So it's also one of those differentiated model of care, designing care as suitable for different populations.
First of all, I mean, all the countries should look at decriminalizing sex work, decriminalizing drug use, decriminalizing same-sex relationships. But where they're not decriminalized, you still have to provide services. So a lot of countries use the constitutional right, which says every human has a right to accessing good health and provide services to everybody, because whether they're LGBTI, sex workers, or drug users, they have the right to good health because they're citizens of the country.
With HIV and AIDS remaining a prevalent health problem in Nigeria, all stakeholders will do well to continue the fight against stigmatization, as well as encourage more testing for all if the ambitious goal of achieving the United Nations AIDS 95 to 95 to 95 target by 2030 is to be attained. Bettinah Nwelih, reporting for News Central.